Good morning, my dear children. In this module, I am going to teach you the rest of the topics in the health infrastructure in India. Children, over the years, India has built a vast health infrastructure and manpower at different levels. Since independence, there has been a significant expansion in the physical provision of health services by the government hospitals. But in recent times, the private sector has been playing a dominant role in medical education and training, medical technology and diagnostics, manufacture and sale of pharmaceuticals, hospital construction, and the provision of medical services. Here, in this private sector hospitals, we can see that in this more than 70% of the hospitals in India are run by the private sector. They control nearly 2/5 of the beds available in the hospitals. Nearly 60% of dispensaries are run by the same private sector. They provide health care for 80% of our patients of outpatients and 46% of inpatients. And this sector has been playing a dominant role in medical education and training. And in 2001-2002, there were more than 13 lakh medical enterprises employing 22 lakh people. More than 80% of them are actually single person owned and operated by one person, occasionally employing the hired workers. Scholars point out that the private sector in India has grown independently without any major regulations. Some private practitioners are not even qualified or registered doctors also, and they are also known as quacks. Since the 1990s, owing to liberalization measures, many non-resident Indians and industrial and pharmaceutical companies have set up the state-of-the-art super specialty hospitals to attract India's rich and medical tourists. So many facilities has been provided by the private infrastructure also. So the private sectors also played a major dominant role in the provision of such medical facilities to even the patients inside our country as well as the outsiders also. And if we analyze the Indian systems of medicine, we can see that it includes 6 systems, that is Ayurveda, Yoga, Unani, Siddha, Naturopathy and Homeopathy. At present, there are 3,943 Ayush hospitals, 27,700 dispensaries, and as many as 7.4 lakh registered practitioners in India. But little has been done to set up a framework to standardize the education or to promote the research. In short, the Indian systems of medicine are known by ISM, and it have huge potential and can even solve all this, a large part of our healthcare problems, because they are effective, safe and inexpensive. So what is about the Indian systems of medicine, isn't it? We can see the 6 systems. Actually it includes 6 systems and it is of varieties of systems also. And if we analyze the indicators of the health and health infrastructure, if we done a critical appraisal of these indicators, we can see the expenditure on health sector is as 4.7% of the total GDP. This is very low as compared to other countries, both developed and developing. But one study points out that the India has about 17% of the world's population, but it bears a frightening 20% of the global burden of diseases. GBD is an indicator used by the experts to gauge the number of people dying prematurely due to a particular disease, as well as the number of years spent by them in a state of disability owing to the disease. Actually, it is a GBD means golden burden disease. It is actually global burden of diseases, and it is used as an indicator by the experts to gauge the number of people dying prematurely due to a particular disease also. And this is actually the different indicators of health and this health infrastructure appraisal. So children, from this we have to understand that different indicators are used to measure the health conditions of the people also. Next we can see that here the statistical measures have been given, and it is also of different countries. Here we can see that in India the infant mortality rate, it is very high compared to China, USA and Sri Lanka. And under 5 mortality, that is for 1000 live births, there also the India's rate is very high. And birth by skilled attendants, that is also the percentage, it is 85.7%. Next one is government health spending as a percentage of GDP. Here it is 4.7%. It is less compared to the other advanced countries. And out of pocket expenditure in a percentage of current health expenditure, here we can see it is 65%. So here we can see if we analyze the statistical measures, we can see there is a rapid changes in different countries also. And the India's rate in related to all these rates are very high also. In India, more than half of the GBD is acquainted by communicable diseases such as diarrhea, malaria and tuberculosis. Every year, around 5 lakh children die of waterborne diseases. The danger of AIDS is also looming large. Malnutrition and inadequate supply of vaccines leads to the death of 2.2 million children every year. At present, less than 20% of the population utilizes public health facilities. Only 38% of the PHCs have the required number of doctors, and only 30% of the PHCs have sufficient stock of medicines also. What is this? This is actually a urban, a rural and poor rich divide. It shows the difference between the urban areas as well as the rural areas. People living in rural areas do not have sufficient medical infrastructure, which has led to differences in the health status of the people. In rural areas, the percentage of people who have no access to proper healthcare facilities has increased over the last few years. Villagers have no access to any specialized medical care like pediatrics, as well as the gynecologist, as well as anesthesia and obstetrics. So actually here we can see that in the villages this pediatrist as well as this gynecologist and anesthesia as well as the obstetrics, these facilities are not available in the village areas. Though 70% of India's population lives in rural areas, only one-fifth of its hospitals, including private hospitals, are located in rural areas. Rural India has only about half the number of dispensaries also. As far as hospitals are concerned, there are only 0.36 hospitals for every 1 lakh people in rural areas, while urban areas have 3.6 hospitals for the same number of people. So, actually, this is a divide between the urban and the rural areas. The PHCs located in rural areas do not even offer X-ray or blood testing facilities, which for a city dweller constitutes basic health care. States like Bihar, Madhya Pradesh, Rajasthan, and Uttar Pradesh are relatively lagging behind in healthcare facilities, even though 380 recognized medical colleges produce about 44,000 medical graduates every year. Out of this 63 lakh beds in government hospitals, roughly 30% are available in rural areas. Children, the statistical measures helps us to compare the disparities between the rural as well as in the urban areas. We have to understand the facilities, yes, available in the rural as well as in the urban areas. As far as hospitals are concerned, there are 0.36 hospitals for every 1 lakh people in rural areas. Isn't it? Yes. So, from this, the inferences that we can make is there are huge disparities between the rural as well as the urban areas. So, children, this is the overview of the private infrastructure as well as the public infrastructure, and as well as the what are the facilities provided by the government hospitals and the private hospitals in different areas also. Through this, we'll be able to understand the regional disparities between or among the people also, those who resides in the rural as well as in the urban areas. But we can say that 70% of the people live in rural areas, but the facilities are not provided. So as a result, what happens? Yes, the death rate increases as well as the diseases also increases, which gradually retards the progress of the human capital, which affects our economic development. So children, so far what I have explained related to the health infrastructure, I hope it's clear for you. So these statistical measures will be very helpful to interpret the the scenario between the urban and the rural people also. Thank you, children.